Hi, and welcome to the Pediatric Dermatology Research Alliance Getting to Know You series, a video series where we get to know more about our PEDRA investigators. I'm Jen Dawson, Outreach Manager for PEDRA, and with me today is Dr. Jennifer Schoch. Dr. Schoch is Clinical Associate Professor and Pediatric Dermatologist at the University of Florida School of Medicine and PEDRA investigator. Welcome, Dr. Schoch, and thank you for being here.
Hi, thank you. Thanks for having me.
Absolutely. So I'm just going to ask you a few questions,
Okay.
and we're going to get to know you.
Okay.
Please tell us a little bit about yourself and how you got involved in pediatric dermatology and dermatology research.
Okay. Well, some people know this about me, not everybody, but before I went to medical school, I was actually a child life specialist. So I worked in the hospital with kids, and I found myself wanting to do more. So I've always wanted to work with kids, but I assumed I would be a pediatrician, maybe do general pediatrics. And then for whatever reason, when I was on my derm rotation, I just loved pediatric dermatology, where you could really solve a mystery, where you could walk in and you could figure out exactly what something was in 2 seconds that people hadn't been able to, 7, 8 doctors hadn't been able to figure out. And so I love that about pediatric dermatology, getting to be sort of a detective. And so it turns out it's been a really good fit for me. I like to be busy in clinic. I like to be able to help a lot of people. So it's a great career choice. Definitely recommend it. And then as far as research, kind of the same thing, because once you start on that kind of path and you want to be, you're inquisitive and you want your brain to be challenged, it's kind of hard to stop. So after about a year in clinic, I found that clinic is challenging on its own, definitely. But I found that I wanted to think more and stretch my brain more a little bit, answer some of the questions that came up in clinic. And so I found myself missing research after just about a year and went back to it, thankfully, with PEDRA's help.
Awesome. What is your research area of focus, and what do you find most interesting about it?
Okay. My research is focusing on the infant skin microbiome. So there's not a lot of people in this area, basically looking at the infant skin right when the baby comes out to try to figure out how the microbes that are on the skin, how that interacts with the baby's immune system and other factors to produce skin disease down the road. And so what's really cool about that is that that's something we can potentially modify. So for example, if we can figure out how the bacteria are affecting the immune system early on, and that's causing maybe eczema, for example, then if we change that interaction early on, we can prevent things like eczema. And I feel like in dermatology, with a lot of the genodermatoses and other things, we see we're making a lot of breakthroughs there, but some of the common things like eczema, we haven't made much progress in prevention. So I think I'm going to be a very tiny piece of this puzzle, but I love the idea of being able to figure out how to prevent something.
Very cool. What message would you like to share with trainees or early investigators who are new to the field and/or research?
It's funny to be asked that, because I still feel like I'm new to the field, even though I've been on my own for about 5 years. So the funny part is that I don't know when you start to feel like you've figured it out, but I'm guessing it's going to be pretty much never. So that's the first lesson, is to keep being open to growing and discovering and changing and adapting, because for me that has been something that I've become more humble to over the last couple of years. The other thing is to be persistent and not give up, because it's really easy to be discouraged. There's going to be a lot of failures and a lot of rejection along the way. There's a lot of papers that won't be accepted, a lot of grants that won't be accepted. And it's really easy to take it personally, but it's not personal. It's all part of the process. And then the last in the same line is to be open to feedback and be open to trying to improve yourself, because if you don't do those things, then you're not going to be living up to your full potential. And nobody comes out of residency or medical school knowing how to be a researcher or a clinical researcher. Nobody else has this figured out either. So everybody has to sort of figure out what skills they have, what skills they have to learn. And there's a very steep learning curve, but it's definitely worth it.
Awesome. Well, thank you so much, Dr. Schoch. It's been great getting to know you.
Yeah, thank you.